So factors that weaken the host defenses and increase susceptibility to infection. Obviously, there are some of these things you could probably list without even, you know these things to be true. The very young and the very old are going to be immunocompromised in a way that their weakened host defenses will increase the likelihood that they're going to be susceptible to infection. Anyone who has an immune, and we talked about this in chapter 16, some immune deficiency, and especially like something with like AIDS, where they have acquired immunodeficiency syndrome. If they're either born with it or they have acquired it, then that is going to weaken their defenses and they're more susceptible. Pregnancy, surgery and organ transplants, underlying disease like cancer, liver malfunction, and diabetes, chemotherapy and immunosuppressive drugs, physical and mental stress, and other infections. So, and I can't express how much physical and mental stress can be a factor in how some people are, you're already stressed and then you get sick. It just adds to the stress, right? But that is something that we do see. And I think when you get into a class like, courses where you're trying to keep track in college with all your classes and try to keep track of your, help your family and all the hats that you wear during the day, that physical and mental stress builds up through the semester. And I do see a lot of people getting sick toward the end of the semester just because of this simple physical and mental stress. So you've got to learn how to, and this is just a side note, not really having to do with microbiology, but just being a college student, you've got to figure out how to manage stress. So endogenous infections, they are ones that are caused by microbiota and they're in the body already. So they are things that enter into other spaces. So they started out in one site and that's where they were occupying that location, but because of maybe damage to an area or for whatever reason, they have moved and they have invaded another area that was previously sterile. Although those particular spaces are becoming less and less, but let's just say that it moves to a different neighborhood in your body. And because of that, like the E. coli is supposed to be in the colon, but if it enters the bladder, then you get a urinary tract infection, a UTI. So that would be a good example of an endogenous infection. C. diff infections are actually because of normal microbiota. You've wiped out your own normal microbiota, so there's no antagonism against C. diff. And if there are low levels of that in your body, taking antibiotics could wipe out the antagonists and it just grows out of control. Similar, and we talked about this in the unit with chemotherapeutic agents, like yeast infections can also happen. But these are because you have these microbiota already present and some of these microbes are potentially pathogenic. So where does it start? A growing number of doctors and scientists believe fetuses are seeded with normal microbiota in utero. And these microbes develop and are important for healthy full-term pregnancies and newborns, healthy newborns. And we know that exposure to occurs at birth when the baby becomes colonized with the mother's vaginal microbiota. And there's a lot of pushing and, when the baby is born, a lot of it's very violent and there's lots of fluids getting up in the nose and going through. And again, this is where that video that I told you from the I Contain Multitudes series about the C-sections versus how do you get that normal microbiota back? How can you obtain your regular, your birthright, which you're born with? If your baby is born C-section, they can possibly return that to the baby by swabbing it with mother's vaginal secretions. So you can watch that and then come back and watch this again. But that is one of the things we know, that there is a very much of a difference because of where on your body you have different microbes in different parts of the body, and where the baby comes out. If it comes through the vagina, it's going to have vaginal microbiota. If it comes through the skin, in a surgical incision, then that's going to have more of the skin microbes, and it's just different. We also know that the breast milk contains around 600 species of bacteria and sugars that the babies can't digest. And so sugars are used by the healthy gut flora or bacteria, and the breast milk can be necessary for maintaining a healthy microbiome in the baby. So breast milk is also important. So where babies get the microbiome, in utero, and again, we previously thought the womb was sterile, but now we understand that the womb probably has its own microbiota, and so they get a lot of that in utero. And then the mother, when the baby is born, the vaginal or C-section deliveries will contribute to different microbiomes, and that's something that we now know. Whether that's good or bad, we don't exactly know, but we do believe that there are some adverse things that happen when the baby is born by C-section, and that if we can somehow restore the microbiota from the vaginal tract, that can be helpful. The breast milk, as we said, it's going to have a lot of different microbes, and caregivers, they touch the baby, and everybody, siblings, family members, everybody who holds the baby is passing on some microbiota. And so you have to be, careful about what you're passing on to the baby. And especially if you are not up to date on your pertussis vaccines, that's something that you need to understand. You could pass pertussis on to the baby, but the normal microbiota is good, pertussis bad. So make sure you're up to date on those vaccinations. Environment, the baby can come into contact with lots of things that they come into contact with, the carpet that they, the baby's bedding, and toys that they have. So a lot of different things. That's where they get their microbiome from. So here are some sites where, and by the way, this table is just for informational purposes, and you will not be tested over this. But I always kind of have to say that because people would want to just memorize this chart, and I usually do like charts, but this is a lot. And I wouldn't be able to tell you these things myself, although I have a pretty good clue. Like above the waist, you generally, like in the nasal cavities and things, you have like gram-positive bacteria, and below the waist, you generally have gram-negative bacteria. So like in the GI tract, and coming out in the feces, you're going to see that. A lot of different kinds of gram-positive bacteria, like I said, in the nose and the mouth and the upper respiratory tract is gram-positive, lots of gram-positives. But that doesn't mean you don't have gram-negatives. So you can see here the Moraxella and the Haemophilus, those are gram-negative bacteria. So, it's just a generalization. So those are just different things that we've seen. And those are sites that we've known. They're pretty well established, and these are some representative examples. So that is the end of section 1. Here are some of the concept check questions. So I'm going to ask the questions, and then I'm going to answer them. So pause the video and then try to answer them, and then come back for the next question. So a condition in which pathogenic microorganisms penetrate host defenses, enter tissues, and multiply is blank. So if you said infection, you would be correct. So question 2, the Human Blank Project collects genetic sequences of microbes from many body sites. If you said Microbiome Project, that is correct. So it's been going on for like 20 years or so. And there's actually the Human Gut Project, and you can actually send a sample of your feces, and they will sequence it for you. And then if you want, you can find out what that information tells you for a price, of course. But they are just kind of collecting samples from all these people, and that's one of the ways that they are getting that information. So question 3, true or false, the lungs are sterile sites. So I would have said previously that is true, but now we're finding that's false, that they actually, the lower respiratory tract, the lungs actually do have some microbiota, or at least the DNA of microbiota present. So question 4, your gut biota can determine your mood and mental health. True or false? So if you remember from the very first chapter, when we looked at the video, again, another one of the I Contain Multitudes videos, in a world without microbes, we learned that the microbes actually can control your mood and mental health. They do have some impact on that, and it's a lot of your gut microbiota. And so it's not just controlling your digestive system and your bowel movements, but it actually can determine your mood and mental health as well. This is one of the reasons why I like to go through these questions, because sometimes I miss that when I go through the lecture itself. But that is one thing that we have learned from the Microbiome project. So question 5, list and describe 3 factors that weaken host defenses and increase susceptibility to infection. So if you said age, prior illness, that would be another big one. Genetics, immunodeficiencies, if you have some acquired or primary immunodeficiencies. Chemotherapy, radiation, those things can weaken your defenses. And so these are some of the things that we mentioned in chapter 14 and 15 as well. But those are some factors, and there are many. So those are just a few. So question 6, true or false, babies born by cesarean section are colonized by the same bacteria or biota as babies born vaginally. So I think I mentioned this 2 or 3 times. That is false. They really do have different microbiota. And again, there's the video from I Contain Multitudes about C-sections versus vaginal delivery will answer some of that. And I hope you watched that video as well.